Across the prairies, we've seen a real increase in the last week in the number of people who are willing to talk about organ donation. Now, over the last decade, Saskatchewan has had one of the lowest rates of organ donors in the entire country. What has to happen to change that, and what can we do as a province to move forward? Well, for a few of his thoughts, I'm joined now by Dr. Stephen Bede. Now, he's a critical care doctor. He works in the intensive care unit here at Royal University Hospital. He's been caring for hockey players who were in that crash for the past week in the ICU. And Dr. Bede is also the national chair of the Deceased Donation Advisory Committee, and that is a national committee here in Canada. Hello, Dr. Bede.
Hello.
What does Saskatchewan need to change, and where do we start?
Well, I think we need to begin by establishing what I would call a donation culture. And what I mean by that is an organization, an entity that focuses on donation-related activities, that's staffed by people who are typically critical care based, who have an interest in training in donation, and who have an infrastructure and reporting mechanism that enables them to support donation-related activities within the critical care units and the province in general.
Now, here in Saskatchewan, we have a transplant program, but we don't have an organ donation program?
No, I think every other province in the country has a donation program to support donation-related activities, and all of them work very, very closely with their transplant colleagues. The intensive care physicians have connected with the transplant community here, but not as the distinct entity to support donation-related activity. Some entity needs to be the voice for donation-related activities, and that's one of the key things that Saskatchewan needs to get established.
Now, the night of the crash, we had so many people coming in here for critical care at RUH. By Saturday morning, there you were in the ICU caring for them. If you look back in time, what are you going to remember about the past week for you?
These are rare, terrible weeks, and I can remember basically an amazing group of people working very hard to do their best for a group of people going through the worst thing you can imagine. And I'm pretty impressed by the way the people here did what they had to do. They really, in my opinion, they did a great job in a really difficult week.
Now, we have heard about Logan Boulet. His family was really big on the fact that, yes, he was an organ donor, and you cared for Logan. What happened with his family after that?
I can only surmise, based on my conversations there, that they were very happy that his gift could help other people, and I hope they carry that message for the rest of their lives. That's been my experience with donor families. The positive that comes from the worst day of their life is something they carry forward. It provides a legacy they carry forward. There's some positive in the middle of what's nothing but bad news, and that's important.
Now, I have got the little sticker on my health card. I'm an organ and tissue donor according to this, and I've talked about it with my family. I've told my mom, I've told my husband. Everybody who knows me should know that I would like to be an organ donor if the time ever came. But it sounds like those times are fairly few and far between.
The clinical situations that lead to somebody to have, quote, brain death are uncommon. A severe injury from trauma, a severe injury to the brain from usually a big stroke or something like that, or lack of oxygen from a heart attack or drowning or whatever. Those circumstances overall are quite uncommon. So the potential organ donor is not something that most of our healthcare team see. And so, given that they have almost certainly had no education around this during medical school or residency, we have a generation of healthcare practitioners who aren't well informed about this topic, and it's a difficult, stressful situation. We need to change that by providing members of the healthcare team education around this topic and support. At the end of the day, in a good system, I would like these people to identify a potential donor and make a phone call to a donation program that's well established and able to meet their needs.
Now, here in Saskatchewan, I mean, we do have one of the lowest rates of organ donation in the country. We also have a high Indigenous population. Do you see any correlation between those two, or?
Not specifically, but I see an opportunity here because many people in the First Nations community have medical conditions that may make them a candidate for transplantation, with kidney failure or whatever.
Diabetes, different complications.
Those kinds of things. And my experience has been that the donation opportunity doesn't happen much within that community. There's a disconnect. People from the broader communities present to the intensive care unit with medical conditions that might make them a potential donor, but the consent discussion with these families hasn't been successful very often. That's a challenge, but it's also a huge opportunity. How do we connect better with the First Nations community so that we can meet the needs of the donor family, but also the broader community? I'm not sure the answer to that, but that's an important discussion to have going forward.
Well, and yeah, there are different elements of spirituality. I think there are just a number of people in this province who also feel a bit creeped out. It's an uncomfortable discussion to have about donating organs and when that time comes.
It's not just donating organs, it's death. And even people who have to deal with death frequently, for example, those in the intensive care unit, our job is to try and make people better. That's why we're there. And we don't like when people are so sick that they're going to die. If they are, then I think we have a real responsibility to provide them the best end-of-life care possible. And affording them the opportunity to become donors is part of good end-of-life care.
Now, you were involved quite heavily in Nova Scotia with getting both the organ donation and tissue donation side of things going, as well as the critical care. Looking at what the rest of Canada is doing, what should Saskatchewan's next step be? What do we have to set up, and how do we go about doing it in a way that'll work?
The establishment of a donation program with donation physicians, those are ICU trained physicians that support a donation mission, is a key first step. We need to establish some kind of a death audit so that missed donation opportunities are identified by reviewing those who did die. That way we can feed the information back to the healthcare teams and say, this is an opportunity that we need to learn from. Let's get you comfortable and educated so the next time we don't miss that opportunity. We need to work with our transplant colleagues to make donation a real institutional priority. This is something we need to fight for because it's a rare, uncommon gift. And I think there's work to be done here around that donation culture. We need to work again with transplant colleagues to develop a very robust donation after cardiocirculatory death program. That's another route to donation that requires a lot of communication with transplant colleagues. That's established here, but there's work to be done. We need to have trained organ donor coordinators who are focused on the needs specifically of the donation community, be that the patients and their families, the healthcare team, the broader population. A robust education system for both our healthcare providers and the public is an objective. Saskatchewan could establish a registry. I don't know where that might be. And the attempt to change the donation culture by talking about organ and tissue donation opportunities has been very successful in Nova Scotia. Tissue donation opportunities occur even in small hospitals every single week because it's a different clinical process. So how about changing a donation culture by supporting the donation gift, be it organ or tissue, and then the message gets to the whole province, big and small. Now that requires the establishment of a whole infrastructure, but that could be an intermediate or long-term goal. It worked in Nova Scotia. If we have a healthcare community who are very engaged and supportive of organ donation, but because of clinical situations it only comes up every few months, interest wanes. But if we get them keyed up to support donation, organ donation may be uncommon, but tissue donation happens all the time. And donor families don't differentiate. They know they made a gift. They're just as happy that their dad gave a kidney as if they helped somebody see again. So that's something Saskatchewan could talk about, but that's probably a little bit more difficult to set up because you need a tissue bank that's established, and I don't know what's happening in Saskatchewan.
Well, but it does sound, though, that after all these heavy feelings, the grieving that this whole province and that the country are going through, it does sound like this is something that we could work at and have some hope and have a little bit of light after a horrible crash like this.
I have a pretty strong feeling that the seeds have been sown here, and we're going to start to see real progress in Saskatchewan. There's real opportunity here, and I hope if we have a conversation in a year, we're going to be looking at much better numbers.
Dr. Bede, thank you so much for this. We really appreciate your time.
I'm happy to help if I can.
Dr. Stephen Bede, a critical care doctor here at Royal University Hospital. He's been looking after the patients who have been in the intensive care ward for the last week, and he's also the national chair of Canada's Deceased Donation Advisory Committee.